The use of technology in healthcare has really changed the way we operate and how we're able to care for our patients, providing us with up-to-date, accurate, and timely information so that we can make intelligent decisions, providing our patients with their best outcomes. So myself personally, I've gone completely paperless. In my office, I scan everything in, documents are sent to me electronically. I no longer print out agendas. If I'm going to attend a meeting, I download it onto my iPad, I open up the agenda while I'm there, and I'm able to take my personal notes. Saves me a tremendous amount of time and provides me data that I'm able to use when questions come up down the line. I try to remember what happened in that meeting. I have it with me at all times. Other ways that we use technology, we have barcode scanners so we can identify our patients to make sure that they're the right patient and they're getting the right medication. Nurses at the bedside are using computers to help with our patient education. They can carry in a handheld device and pull up information, sometimes including animation or just drawings, and be able to help the patient understand a little bit more about the pathology that is occurring at the time. In addition, we have Marty, which is our translation, so that provides both interpretation and also sign language for our patients, all done through the internet in real time, which is a phenomenal opportunity to be able to make sure that our patients truly understand what's going to happen to them and be able to ask us questions instead of trying to wait for an interpreter to be able to be here available on site. We have a simulation lab where we use SimMan to be able to train not just our new nurses that enter into our hospital, but also provide challenging scenarios for our current staff to be able to play out and practice without worrying about, how is the patient going to feel about somebody doing that to them. That's been a tremendous asset for us being able to provide around the clock, 24/7 education whenever it's needed, whether you have one person that needs the education or a whole group of people that happen to start at the same time. We have a robot in our pharmacy which picks the meds, drops them into a little bin, and then of course they're rechecked by a human before they're sent out to the unit. And then there are in drawers that have barcode scanners on them as well as our barcode scans that our patients wear to ensure again that the correct medication is being dispensed to our patients.
Well, we've been using computerized physician order entry for about 1.5 years in the emergency department, and it's really made a big impact on the way we practice. Before that, we would write them on paper and hand them to a unit coordinator, and then it would take a period of time for those orders to get entered. So with CPOE, as we call it, the orders get in there the second we place them. Many processes are happening at that same time where radiology knows and laboratory knows and nursing all know when we place an order. So it's been very helpful for us from that standpoint. It also will flag me if I'm putting in an order and the patient has an allergy to a medication, it'll alert me to that, which is a big help. In addition, we use the electronic system to write prescriptions for patients, which is a time saver, and by having it electronic, we don't have any problems with writing the dosage incorrectly. For healthcare to survive in this era of reform, we need to be efficient. We need to remove anything that doesn't add value to the patient, and we need to be cognizant of anything that is more costly than it needs to be. So by using the electronic system, I can quickly see that the patient has been in the emergency department or in the hospital system or the health system previously and may have had a CAT scan or another high-level imaging study, and I don't need to redo that test.
I think in our society we're used to having things pretty easily accessible at all times, and the example I like to use is you can travel into another country, go with your bank card and get access to your money no matter where you are. And I think folks would like to have that same accessibility with their electronic, with their health records, with their medical record. Knowing you could show up in a hospital anywhere in the country, anywhere in the world, and the physicians taking care of you there have access to see prior history and prior tests and labs and studies that have been done. That's the ultimate end goal. And you want your doctor, your physician assistant, your PA, your APRN, you want your provider to come in and be able to talk to you, and you want them to care for you. And you also want them to have all the tools they need to take care of you effectively and efficiently and safety. And an outpatient chart, an outpatient electronic medical record, can give reminders about when a woman's due for her next mammogram, or when a man's due for his next prostate check, or when someone with diabetes has had all their regular maintenance that go along with good clinical care for diabetes. So you want the computer to kind of act as a second brain or another piece of information to get the patient's care optimal. It's a really exciting time, and I'm happy to be working on a lot of the different projects because I believe in them and I know that they can help us take excellent care of our patients.
This award is a testament to the cooperative work of the Backus medical staff and the administration of the hospital. The electronic medical record will allow our physicians to provide seamless care to our patients in a more cost-effective manner. This will ultimately result in better care for our patients.
We are very pleased to win this award, which recognizes excellence in information technology. This award is based upon Backus's progress in the management and use of technology in improving the clinical care of our patients. This award also recognizes Backus's use of technology in various care settings, in our hospital, in our home health agency, in our outpatient care centers, and our connectivity with physicians and our community health providers. I would like to extend a heartfelt thank you to all of my colleagues here at Backus, and a very sincere thank you to our very talented MIS staff.